Yeah, Neeraj, I have one PPT to share. As you can see, these pictures, you'll notice that every patient is having a severe contracture in the wrist joint and their hands are also bent. But the thing is, since the brain injury can happen at any part of the brain, not sure. I mean, why everyone's hand are bent like this? I mean, that is kind of question to all the physiotherapists. They can think about this, the situation, like irrespective of, the injury at any place of the brain, everyone is having, the same situation here. And even the son of Microsoft CEO, Satya Nadella, he is also no exception to that. So let me just move on to that slide. Yeah. So here you can see the picture of Zen, who is a son of Satya Nadella. And you all know that Satya Nadella is among the top 10 richest person in the world. So you can imagine how much, the money he must have spent for the treatment of his dear son, Zen. But by looking at the photo, one thing is clear, that no matter how much money you spend, if the direction of the treatment is not right, then the true recovery of the CP patient becomes extremely difficult. And then option only remain to maintain the patient. I mean, if I want to specifically talk in terms of what Dr. Vasa always mentioned, so in this case, we do not left with any option other than maintaining the patient, and that's what precisely seems to be happening here in case of Zen. You can see that he's sitting in the most advanced chair. His neck is rested, foots are supported, chair is powered with the battery and whatnot. But what's the use of this technology from the independence perspective, right? So that is the case. I mean, if the direction is not right, then no matter. I mean, how much money you spend, the patient will. It will be very difficult for patient to be path on the independence. Now let me move on to the next slide. So this is the picture of one rehabilitation center wherein you can see the different CP children or the CP patients. They are accompanied with physiotherapists and the doctors. But looking at their physical dependency, can we really see that all these patients are truly on the path of recovery? Because they are either seated on the special wheelchair, or some patients are standing using the frame. So everyone has given the external support. The thing is, brain injury makes the patient's prisoner. The brain injury makes the patient prisoner of their own body, and by making them sit on the chair with the chest belt and so many straps around, aren't we making the body also prisoner of the external support? So that is also another thing to think of. And I would like to mention one quote here. When a flower doesn't bloom, so you fix the environment in which it grows, and you do not fix the flower, right? So on the similar lines, if we think, when the baby does not achieve the milestone due to brain injury, rather than forcefully making the baby stand or walk, shouldn't the focus be on reorganizing and developing the brain? I mean, this is also a very important question, and I would definitely have all the physiotherapists, all the doctors who have joined this session to think about this important question. Now let's quickly go through some of the cases wherein the children has significantly improved after following the Vasa concept. So let me just go through these slides very quickly. So you can see here the Sasha from Russia. So this is the condition of that particular baby before Vasa concept. No trunk control at all. And the baby was made to crawl using some Dovan's method, Glenn Dovan's method. Now with the Vasa concept, within 5 days, that particular baby got the trunk control, and you can see in this picture, the baby is sitting in the Buddha position, and also came to dog position very well. So you can see the big difference here. In the following slide, the same baby is playing with the toys, sitting nicely, doing some activities. This is another case Angie. She's from Holland. So you can see that physiotherapist made her stand, uh, irrespective of the knee recovery button. And you can also see that in the second picture, that she is provided with external oxygen supply. So this is not required at all. I mean, with the Vasa concept, Dr. Vasa has given very simple exercise called as a chest pumping, with which we can give the natural oxygen to all the CP patients. So the Vasa concept actually provide the simplest solution to the complex problem. I mean, that is precisely. I mean, we can say. Now the same, the child, she is, she has made stand with the help of standing frame and some patterning methods of Glenn domain. And now see the difference with the Vasa concept. Now the child can sit and do some exercise very actively. This is again, the Vasa concept. This is the another case wherein you can see because of the too much tightness in the hip, that particular child is not able to sit in Buddha position, proper Buddha position, and his knees are also bent and touching to ground. Now with the Vasa concept, you can see a big difference. The child is sitting in Buddha position very comfortably. Child is also maintaining the balance on gym ball and doing some activities. These are the different exercises. All right. So, in the interest of time, I'll just quickly wrap up this PPT. And before I ask Mr. Jaya Selgar to cover the case of autism, I would like to show just one uh, photo. So this is the evidence of the how the Vasa concept is uh, having the growing interest in the Western countries. So she is Isabel from France. So she has very keen interest in the Vasa concept. So she is examining the patient who is undergoing the treatment with Vasa concept. So that is the thing I wanted to quickly share.